Flexibility assessment tests. The flexibility assessment is to be conducted the Canadian trunk forward flexion test, the YMCA sit and reach test, the chair sit and reach test, and the Thomas hip flexion test. In the Canadian trunk forward flexion test, have participants remove their shoes. They must sit with feet flat against the sit and reach box with fingertips placed at the 26 centimeter mark. The inner edge of their soles are placed within 2 centimeters of measuring scale. When testing, the participants are instructed to slowly reach forward as far as possible and hold the furthest position for 2 seconds for it to be an acceptable measurement. During this movement, instruct the participants to breathe out on all reaching parts of the test. Testers should ensure that knees of the participants stay extended and do not press down on their knees to help them. The YMCA sit and reach test. Participants also must remove their shoes. A yardstick is placed on the floor and held down by tape. The tape is placed across the yardstick, making a right angle at the 15-inch marker. Have participants sit at the yardstick between their legs. Legs are extended at right angles to the line taped on the floor. The heels of the feet should be touching the edge of the tape and feet are placed 10 to 12 inches apart. When testing, the participants are instructed slowly to reach forward and far as possible. Take the best of 2 measurements. Sit and reach tests. In assessing a population that cannot participate in the YMC protocol, the chair sit and reach test protocol is acceptable. Many individuals have functional limitations that prevent them from getting down into the floor and conducting the tests. The chair should be first 17 inches in height and placed against the wall. There is no need to remove their shoes for this one. Extend one leg with the ankle dorsiflex. Keep untested leg flat on the floor. Keep head in normal alignment. Then participants are instructed to slowly reach forward as far as possible and hold the furthest position for 2 seconds for it to be an acceptable measurement and also to breathe out when reaching down. Take the best of 2 measurements. For the Thomas test, assessments is used for hip flexion flexibility. This test is administered to check for imbalances between the hip flexors and hip extensors. These imbalances can have negative effects on lower back. Lay supine on your back, bring leg to chest. Try to keep the opposite leg flat on the floor, as flat as possible. If the rises up, then it is considered inflexible, and flexible if it does not.